Hi, my name is Sarah Buckley, and this is going to be the head and neck assessment video. This is my patient, Sharon Buckley. She's my mom. Do you consent to have this exam done and it to be recorded?
Yes.
Okay. All right, so first I'm going to wash my hands. All right, we're just going to look at your head first. Everything looks symmetric. There's no lesions, cuts, depressions, no lumps. Is there any tenderness on your head?
No.
Your face looks symmetric, your contour is good, you have no movements, there's no masses or edema. Next, we're going to move on to your eyes. Your eyelids and eyelashes look symmetric. Your eyelashes are going outward. Your eyebrows are symmetric. All right, I'm going to take a look at your eyes. You have brown irises. And I'm just going to use this light just to look at your eyes in general. Your sclera are white. Your corneas look good. There's no nodules and your color is appropriate for ethnicity. I'm going to shine this pen light in your eye to assess your pupils. I'd say they're about a size 3. If you can put your glasses on for me, Sharon, and I'm going to hold this eye chart over here. If you could read the smallest line that you can. Cover one eye for me. Thank you.
All right. LTFPH.
And then this different eye.
LTFPH.
Good. You read the very last line, which is 2020. Now I'm going to move this pen towards your eyes. And next I am going to assess your confrontation. So I'm going to put my fingers out in this area, and I want you to tell me when you can see them coming in.
Now. 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 Now.
And I'm going to do the same thing with this little red pin. Just let me know when the pin, you can see the red.
Now. 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 Now.
Thank you. All right, I'm going to turn the lights off. And I'm going to look into your eyes. See the red reflex? Look in this one. You can see the red reflex as well. I'm gonna also just take a look at your whites of your eyes. If you could look up for me. Good. I'm gonna look again. See your cornea and your retina and the optic disc. Other eye. All right, next I'm going to take a look at your ears. I'm just going to look at both of them. Your ears are both pierced. Any tenderness or pain when I do this?
No.
Okay. And on this side?
No.
Okay. I'm going to take a look inside of your ears. On this side. A little bit of serum, but that's okay. Your on this side as well. Color looks good, normal. No foreign bodies, everything looked good, no redness or swelling or any lesions. Next, I'm going to assess your hearing. I know you wear hearing aids, Sharon, so if you could put those in for me. Stay on.
Yes.
I'm going to first do the whisper test. I'm going to stand on this side of you. If you could block this ear with your hand. And I'm going to say 3 letters, combinations of numbers, and you just let me know if you can hear them. A, 3, B. Can you repeat them back?
A3B.
And next I'm going to do the other side. D5W.
D5W.
All right, good. Next I'm going to do the Weber test. I'm going to hit this and then place it on the top of your head. Let me know if you can hear it in both ears. Yes.
Yeah.
Next, I'm going to do the Rhine test. I'm going to place this on this part of your ear. You tell me when you can no longer hear it.
It's gone.
And can you hear now?
Yes.
And next, the other side.
It's gone. Yes.
All right, next I'm going to take a look at your nose. Let's see. Looks slightly asymmetric, but that's normal for noses. There's no lesions on the outside. If you could occlude one nostril for me and just take a breath in, and then the other side. All right, I'm going to take a look inside as well. And the other one. And there's no swelling, bleeding, no polyps, no deviations. I'm next going to test your function of smell. So if you could occlude one nose and tell me if you can smell this.
Yes.
And then the other one.
Yes.
Okay. I'm going to just palpate your sinuses up here. There's no tenderness, any pain when I press.
No.
Next, we're going to take a look at your mouth. I'm just going to put some gloves on. Your lips look symmetric, pink in color. You don't have any cracking, any ulcers, no lumps. If you could open your mouth for me. I'm just going to take a look inside. I'm going to use a tongue depressor just to look around your mouth as well. Pink. Good moisture. Are any of your teeth loose?
No.
I don't see any white patches. If you could open up again for me, I'm going to stick this here, and if you could say ah.
Ah.
Good. There's no redness, swelling at your tonsils. Your pharynx looks good. And I'm also going to just take a look at your tongue. If you could stick your tongue out, and I'm just going to grab it with this gauze just to look on the sides, as well as look underneath. Good. Oh. Lastly, I'm just going to look at your neck. I don't see any asymmetry. There's no lesions. There's no glands. You don't have a goiter. I'm going to palpate your lymph nodes. Don't feel anything out of the ordinary. Any tenderness when I palpate any of those?
No.
Lastly, I'm going to look at your trachea and just deviate it one way and then the other. Equal amount of space. And then lastly, we're just going to take a look at your thyroid. Just palpate that. Good. Thank you for your cooperation.
Thank you.